Heart attacks remain one of the leading causes of death globally, and while both men and women are at risk, the way these events present in the body can differ dramatically depending on gender. For decades, the medical system was primarily trained to recognize heart attacks based on male physiology and symptoms, which has unfortunately left many women underdiagnosed and underserved. As our understanding of cardiovascular health deepens, it's crucial that we shift both awareness and medical practices to better reflect the unique ways heart disease affects women. Let's explore the key differences in heart attack symptoms between men and women, why these differences matter, and what the healthcare system can do to save more lives by tailoring care with gender-specific insight. Number 1, the traditional male model of heart attack symptoms. For generations, the medical definition of a heart attack has been based on how it presents in men: sudden, crushing chest pain, pain radiating down the left arm, shortness of breath, and sweating. These textbook symptoms are what most people, including healthcare providers, are trained to recognize. This classic pattern, often referred to as the Hollywood heart attack, tends to be more consistent in male patients because of how their cardiovascular systems respond to plaque buildup and arterial blockages. Men often develop blockages in their larger coronary arteries, which produce these more recognizable symptoms. As a result, emergency response systems and diagnostic criteria have traditionally been built around this model. While effective for many male patients, this approach leaves a large portion of the population at serious risk of delayed or misdiagnosis. Number 2, how women experience heart attacks differently. Women's symptoms during a heart attack are often far less dramatic and far more easily ignored. Rather than experiencing sudden and intense chest pain, women may report pressure or discomfort in the chest that feels like indigestion, tightness, or even mild burning. They might experience nausea, fatigue, lightheadedness, shortness of breath, or pain in the jaw, back, or neck. These symptoms can be gradual and vague, making it easy for women themselves to dismiss them or attribute them to stress, exhaustion, or other benign causes. Unlike men, women are more likely to experience what is called a silent heart attack, where symptoms are so mild that they go unnoticed until much later, if ever. This not only delays treatment, but increases the risk of long-term damage or fatal outcomes. Number 3, the biology behind the gender differences. Biological and hormonal differences between men and women are partly responsible for the contrasting heart attack symptoms. Estrogen offers women a degree of cardiovascular protection during their reproductive years, helping to keep blood vessels flexible and cholesterol levels in check. However, after menopause, that protection drops significantly, leading to increased heart disease risk. Women are also more prone to microvascular disease, a condition where the small arteries that feed the heart become damaged or constricted. This condition can cause restricted blood flow without producing the large arterial blockages typically seen in men. As a result, diagnostic tools like angiograms, which are effective in detecting large blockages, may not always detect the problem in women, leading to misdiagnoses or underdiagnoses. Number 4, the dangerous reality of misdiagnosis. One of the most alarming issues in women's heart health is the high rate of misdiagnosis. Studies show that women are more likely than men to be sent home from emergency rooms with their heart attack symptoms labeled as anxiety, acid reflux, or even menopause-related discomfort. This is not only frustrating, it can be deadly. When a heart attack goes unrecognized, the window for critical intervention narrows, increasing the risk of heart failure, permanent damage, or death. This misdiagnosis isn't always due to neglect. Often it's rooted in outdated training and the underrepresentation of women in clinical studies. Until recently, most heart disease research focused primarily on men, leaving a gap in our understanding of how heart disease manifests in women. The result is a dangerous delay in care that disproportionately affects female patients across all ages and backgrounds. Number 5, emotional and psychological symptoms in women. Women often experience heart attacks with emotional or subtle symptoms that are easy to overlook. Instead of intense chest pain, many feel unexplained anxiety, overwhelming fatigue, or a sense that something isn't right. These symptoms can appear days before the event and are often mistaken for stress, hormonal changes, or even panic attacks. Physical symptoms may include jaw pain, upper back discomfort, nausea, or shortness of breath, rather than the classic left arm pain and crushing chest pressure more common in men. Because these signs don't match the traditional male model of a heart attack, women are frequently misdiagnosed or sent home. Standard tests can also miss heart issues more common in women, like microvascular disease or spontaneous coronary artery dissection. When women say they feel off or exhausted for no clear reason, it's essential that healthcare providers take them seriously and consider a heart-related cause. Recognizing these gender-specific symptoms early could save lives. Heart attack symptoms in men and women are often drastically different, and recognizing this difference is critical for timely diagnosis and treatment. While men typically experience the classic signs such as chest pain, shortness of breath, and arm discomfort, women are more likely to have subtle, atypical symptoms like jaw or back pain, nausea, extreme fatigue, or even emotional distress. These symptoms are often milder, come on gradually, and can easily be misattributed to less serious conditions. Because of this, women are at a greater risk of being misdiagnosed or dismissed altogether. Bridging this gap starts with awareness, both in the medical community and among the public. Understanding that heart disease doesn't present the same way in everyone is essential to ensuring that all people, regardless of gender, receive the life-saving care they need when they need it most.